Hi, my name's Karissa, and I'm going to be performing a wound change dressing today. We're going to start by performing hand hygiene. And I'm going to go in and provide my patient privacy and introduce myself and explain to the patient what I'm going to be doing. Hi, how are you today? My name's Karissa. I'll be your nurse. Can I just have you state your name and date of birth? All right, perfect. And are you feeling any pain today? No, on a scale from 0 to 10 to 0? All right, perfect. Okay, so are you feeling any nausea today? No? Okay. I'm going to lay the bed flat. And move it up to a working height. I'm going to put on gloves. Just going to pull this down. I'm going to use this for an area to put my trash. And I'm just going to remove the dressing, okay? So I'm going to slowly and gently remove the dressing. And I'm going to assess the dressing for the color, the amount, the type, and the smell. And I'm also going to be checking the document, and it said that it had 2 of the 4x4s, and it did have 2, so I'm also going to make sure that I document that as well. I'm also assessing the wound, and I'm looking for granulation tissue, which it does have, so that means that it's healing correctly. And I'm also going to palpate for any pain, and also while I'm palpating, I'm checking for any bogginess. There is no bogginess, so now I'm going to measure the length. Okay. Just 14 centimeters, and the width from the widest part, which is 2.5 centimeters. And I'm also going to take my sterile cotton tip and measure the depth of it, placing it in the deepest point of the wound, and sliding my fingers down, making sure to not actually touch the wound. And I'm going to measure that as well. And the depth is 2.5 centimeters. So now I'm going to open this. Remove my gloves and perform hand hygiene. I'm going to remove this because I will not be using it. And I'm going to open this. Making sure to move it away from me. And I'm also going to dump my contents onto my sterile field. And I am going to have my sterile water right here, and I am going to make sure that it is not opened, and if it was opened within the past 24 hours, then I would make sure to lip it before I pour it. But this has never been opened, so I do not have to lip it. While pouring, I'm going to make sure that the label is in the palm of my hand, and I'm going to pour 4 to 6 inches above, making sure that there is no splashing onto my sterile field. And now I'm going to go around and don my sterile gloves. Making sure to not turn my back on the sterile field. To just start to set everything up. So I'm going to take 2 of the 4x4s because there was 2 inside of the wound and 2 documented, and I'm just gonna open these to make it easier and place them in my sterile water, making sure to not get my hand wet while doing that. And I do not need this. So I'm going to start by cleaning the wound. Starting from the top and directly in the middle, going to the bottom in a spiral motion. And to the side, again from the top to bottom, in a spiral motion. And again from the top to the bottom, in a spiral motion. So now with my non-dominant hand, is going to become clean because I'm going to pick up the wet 4x4s to start packing the wound. Taking my sterile forceps, I'm going to begin to lightly pack the wound. Taking the other 4x4. Again, still making sure that I'm lightly packing the wound. Okay. So now, not making sure to not use my non-dominant hand because that is now clean. I'm going to place 2 of the 4x4s over the wound. A D-pad. And I'm going to tape in a window border. Jesus. Making sure that it is securely taped. And then I'm also going to be placing a piece of tape over the wound, the dressing, with my name and the date on it. I'm going to remove my gloves. Clean everything up. Covering my patient, lowering the bed, and making sure my patient is comfortable. I would also have documented all my findings, to be the number, the color, the amount, the type, and the smell of the drainage from the wound, the amount of 4x4s.